What is the role of a care partner for someone undergoing bispecific antibody therapy?
Yeah, the care partner is, I think, a critical component of someone receiving bispecific therapy. And the reason is really to do with the side effects and monitoring the side effects of the therapy. What's the big side effect of the bispecific antibodies is, again, when those T cells engage the cancer cells, and they find the cancer, they release chemicals to destroy the cancer immediately. And those chemicals are from the T cells, can cause people to feel very ill, or can cause them to feel very ill very quickly, or they can have fevers and they can have difficulty breathing. And that's called cytokine release syndrome. Cytokines are the chemicals that the T cells are using to kill the cancer cells. Release, meaning the T cells are releasing that, and syndrome, meaning that different things can happen to different people. And so monitoring, and the highest risk for the cytokine release syndrome is usually within the first 2 or 3 treatments, usually in the first 2 or 3 days of the therapy. And a lot of times when people get the bispecific antibodies, sometimes it's given in a brief hospitalization, like an overnight hospitalization, then they go home. And then the trick is monitoring for that cytokine release syndrome, the fevers that can be associated with that, shortness of breath, low blood pressure, and having, a couple people observing, watching for those signs and symptoms are really important because because if the cytokine release syndrome isn't addressed immediately, it can progress to worse outcomes, meaning that the blood pressure gets lower, the difficulty in breathing gets worse. Sometimes people, if let completely go, people can end up, in the intensive care unit, which is very, very, very rare. But that's why we address this as early as possible. The other side effect, and probably the kind of the most subtle thing, are some of the neurologic things that can happen with the bispecific antibodies. So it's the neurologic toxicity, or some people call it ICANS. And that's when some of those cytokines that we talked about that are from the T cells can cross the blood-brain barrier and cause patients to be confused. They can have word-finding difficulties. They can feel almost like have stroke-like symptoms. They're temporary, but they definitely need to be addressed. And sometimes patients may not be aware that they can't find the right word, or they want to speak and the words don't come out, or when they speak, it's the wrong words are coming out. And that's a real, real big sign that you need to call your doctor immediately or your provider immediately if you have those neurologic symptoms. So watching for those side effects, the low blood pressure, the high fevers, and stroke-like symptoms. It's not a stroke, but it's just those chemicals in the brain that can cause people to have some neurologic problems. And again, if you address those immediately, they are definitely reversible.